Good afternoon, everyone. My topic is surgical management of acute hydrops in keratoconus at a tertiary care center of Jharkhand. Introduction. Keratoconus is a progressive bilateral corneal ectatic disorder. It manifests at puberty, late teens, and early 20s. It can occur secondary to trauma, vernal keratoconjunctivitis, congenital conditions such as Down syndrome, Marfan syndrome, and Ehlers-Danlos syndrome. Aim of the study is to see the effectiveness of intracameral injection of air and keratoplasty in different eyes presented with acute hydrops due to keratoconus. Materials and methods. 4 eyes of 4 patients of keratoconus presented with acute hydrops were included, 3 male, 1 female, with age range from 16 to 28 years. Intracameral injection of air was given in all 4 eyes. The period of persistence of corneal edema, the interval between the onset of acute hydrops and the time when the eye could begin to wear hard contact lens, and the best corrected visual acuity were observed to see the requirement of subsequent keratoplasty. This is the pre-op and post-op picture of the patient with intracameral air injection. Results. Full resolution of corneal edema was seen in 2 patients within 4 to 5 weeks. The best corrected visual acuity after the corneal edema subsided was similar for the 2 patients, which was 6/12, and both patients were able to wear contact lens after 5 to 6 weeks. In the other 2 patients, edema resolved into a scar, which was visually significant, thus penetrating keratoplasty was advised. Conclusion. The results suggest that intracameral air is safe and useful therapy to resolve corneal edema in acute hydrops secondary to keratoconus. Although intracameral air does not affect the final visual outcome, it reduces the duration of morbidity and also the risk of complications such as corneal neovascularization. However, in cases with extensive edema, when the hydrops heals and leave a residual scar, the patient may require keratoplasty for visual rehabilitation subsequently. Discussion. The cause of acute hydrops is rupture of Decimus membrane, which create a gap so that aqueous from the anterior chamber percolates into the corneal stroma. Intracameral air induces no complications. Other procedures such as compressive sutures along with gas injection, cyanoacrylate tissue adhesive with BCL, AMT, and cauterization has been tried in persistent hydrops. More studies with more sample size and long follow-up is required to know the long-term effect of the treatment. Thank you.
Very nice presentation. And
thank you, sir.
The patient was there in the follow-up for the keratoplasty?
Yes, sir. The patients were still in follow-up. The 2 patients.
Did you operate that for the keratoplasty or not?
Sir, they were advised for keratoplasty, but
due to non-availability of tissue, or it's your center is not managing keratoplasty?
Sir,
would it have been better to do the keratoplasty at the first when the patient presents with the acute hydrops?
Yes, sir. The study is basically to see the effectiveness of intracameral air. So intracameral.
Thank you.
Yes,
thanks.
Thank you.